All of us love our bodies. But sometimes the tiny imperfections of nature or former scars and wounds bother us. Can we undo these so that we can look the way we want to? The Department of Plastic Surgery at Care Hospitals is committed to making this a reality.
As people think plastic surgery means only cosmetic surgery, it is not like that. Plastic surgery, we see a lot of other reconstructive procedures that involving the injuries face and injury to the hand, injury to the lower limbs, and microsurgeries. Next, congenital defects like cleft lip palate, congenital hand anomalies. The third is the post-oncology reconstruction, like where oncologists will remove the chin, head and neck surgeries, and breast reconstruction, abdominal surgeries. These are all covered by plastic surgeons.
The birth of a baby is a time for celebration. But if our little ones have a cleft lip or an abnormal hand, it worries us. How will these perceived physical imperfections affect their sense of identity? Will these perceptions affect their confidence and shatter their dreams?
Most of the congenital conditions are correctable and treatable both emotionally, socially and surgically. More than the patient being emotionally depressed, which he will eventually get to if he is not treated and he grows into adulthood, the depression and the emotional or the social factors are more concerned with the parents. So we generally are very sympathetic and we show them the pictures of the previous surgeries we have done, and we motivate them and tell them that all these are correctable deformities.
Every child deserves to attain his or her full potential, and nothing should stop them from it, least of all these imperfections. We at Care Hospitals work towards correcting congenital deformities and keep your child's hope and dreams alive.
Fortunately, many of the children who come to us for these congenital conditions are usually very small. If there is a deficiency in the fusion of the interior or the hard palate, we call it a cleft palate. Cleft palate has got more functional deformities, in the sense the speech is usually affected because the muscles associated with speech, which attach in the hard palate, because of the cleft, these are also deranged and they're attached in a different position. So our duty lies in correcting all these muscles and getting them back to their normal position, as well as closing the cleft palate. This surgery is called palatoplasty. So along with the palatoplasty, we also do a lot of other congenital deformities like the radial club hand and a condition called epispadias.
When we recover from a surgery or a trauma, we want to forget unpleasant memories and move on. But restricted functionality due to injuries or the scars from these surgeries prevent us from leaving the past behind. With our systematic multidisciplinary surgical procedures, we reconstruct the required organs, restore the functionality, and also minimize the scars.
We are the unique breed of clinicians who get to deal with all the specialties, whether it is medical or surgical. Like oncology, where patient has a breast cancer, they have removed it, and patient would eventually develop depression because of loss of breast. So reconstructing the breast would get her out of this situation. We as a plastic surgeon strive to get back the form and function of the patient and remove the scars, both physically and mentally, what the patient has acquired or has sustained it as a trauma.
All of us are magnificent creations of nature. But there are times when a crossed nose bone, loose skin under the arms, or a drooping eyebrow bothers us. We wish to change these imperfections so we can look the way we want to. At the Department of Plastic Surgery, we have advanced cosmetic procedures to help you fulfill this desire.
We are able to execute complex surgeries as long as 8 to 10 hours with a predictable outcome because of our extremely well-equipped operation theatre setup, a very experienced team of anesthesiologists, a dedicated team of nursing staff. Along with that, we have an extremely dedicated physiotherapy team. We do have Lysonics ultrasound assisted liposuction machine, which enables us to give the best possible outcome. So is the case with our high-end microscope from Zeiss, which has enlarged our scope to do the more complex reconstruction, giving with more certainty, more consistent result, more quality result, more precision in our outcomes.
There are people who try different dietary patterns and religiously follow a workout regimen to get into intended shape. Still, they get bogged down when they can't get rid of the excessive fat deposits that ward off the abdominal region or anywhere in the body. Here, genetics also comes into play. Luckily, there are procedures that can help them.
We do a lot of male breast reductions, rhinoplasty, and surgical tummy tuck. Tummy tuck is a procedure where the excess abdominal girth and the width is decreased by lipoabdominoplasty. And we do a lot of facial procedures like fat filling and non-surgical facial cosmetic surgery like Botox, fillers, and you are the best lasers in available, which we do a lot of procedures on the lasers to improve their appearance, and it is called facial regeneration surgeries.
Be it a minor lifting of the eyebrow or a complicated breast reconstruction, we at the Department of Plastic Surgery are committed to providing care that you can trust to help you begin life afresh.